Welcome to Alberta Rheumatology's discussion on gout. Gout is a common type of arthritis that usually affects only one joint at a time. It characteristically presents as the sudden onset of a very painful, swollen, red-hot joint. The base of the big toe is most commonly affected, but it can occur in any joint. Gout is caused by the buildup of uric acid in the blood. Uric acid deposits in the joint, forming crystals, which the immune system then attacks. This leads to inflammation, pain, and swelling, or the gout attack. A gout attack will typically last about 1 week if untreated, but it starts to last longer if left untreated continually over the years. Males over the age of 40 are typically the ones who get gout. In fact, a young woman is very unlikely to have a gout attack. Family history is another risk factor, as is alcohol consumption, especially beer. Being overweight and consuming certain foods for some people can also increase your risk, as well as medical conditions such as kidney disease and taking certain medications. The diagnosis of gout involves you telling your story and your symptoms to your doctor, who will then perform a physical exam. Sometimes a sample of inflamed fluid from the involved joint is taken to provide a definite diagnosis, where uric acid crystals would be seen under a microscope. Usually no X-ray is needed, and there's no blood test that can confirm the diagnosis. Some people believe that high uric acid levels alone can give you gout, but this isn't entirely true, and they often drop to low or normal levels during an attack. There are two methods in treating gout: treating the acute attacks and preventing future attacks. When it comes to treating acute attacks, anti-inflammatories are often used, such as indomethacin and naproxen. Colchicine is another very important medication that may abort an attack if taken soon enough at the first onset of symptoms. Cortisone injections are safe and limit exposure to other areas of the body, but they're most ideal for larger joints. Taking steroids by mouth, such as prednisone, is usually avoided if possible due to side effects, but sometimes may be used if other options are not appropriate. Preventing future attacks is important in patients whose gout is causing more than 2 to 3 attacks per year, kidney problems, tophi, where uric acid deposits outside of the joint, and joint destruction. Treatment lowers uric acid levels in the blood so that any that is built up in the joints can return to the blood and ultimately leave the body. Allopurinol is the most common medication used for preventing future gout attacks, although there are a couple of important things to remember when taking this medication. You should not stop taking allopurinol during a flare, and you should not stop taking allopurinol after a flare. Doing either of these can make attacks worse or even cause them. Other strategies to reduce the risk of gout include limiting alcohol intake, especially beer, managing weight, possibly consuming vitamin C, and paying attention to your diet. While specific diets are not necessary, if you have identified a certain food that causes attacks in you, simply avoid it. For more information, please visit our website at albertarheumatology.com or discuss further with your doctor.